Healthcare providers estimate that up to 10% of men or people AMAB will have balanitis during their lifetime. Balanitis is more likely to occur in uncircumcised children under the age of 4. In this video, we will talk about this disease, balanitis, by answering these questions. What is balanitis? What are the types of balanitis? What causes balanitis? Symptoms of balanitis. How's it treated? What is balanitis? Balanitis is inflammation of the glans penis, affecting approximately 3% to 11% of males during their lifetime. While fairly common and not typically serious, the inflammation is often accompanied by other uncomfortable symptoms. There are 3 types of balanitis. Zuhn's balanitis, also just called balanitis. This chronic, long-lasting type affects uncircumcised, middle-aged people and causes an inflamed, discolored penis head. It accounts for up to 10% of balanitis cases. Circinate balanitis. This type of balanitis is by reactive arthritis, which is a type of arthritis that's triggered by infection. With this type of balanitis, the inflammation is also accompanied by tiny sores on the head of the penis. Pseudoepithelium. It's keratotic and micaceous balanitis. This very rare form of balanitis causes scaly warts or bumps on the head of your penis. It affects people over 6. What causes balanitis? Balanitis is most often caused by a fungal infection, like genital yeast infection, candidiasis, but bacterial infections can cause it, too. Other causes of balanitis include sexually transmitted infections, scabies, tiny burrowing parasite infection, sensitivity or allergy to harsh soaps or chemicals, skin conditions that cause itchy, dry, scaly skin, such as psoriasis and eczema, diabetes, reactive arthritis, a type of arthritis that develops in response to an infection somewhere in your body. Symptoms of balanitis. With balanitis, the head of your penis is usually swollen, itchy and sore. It usually looks red, but this may be less obvious on brown or black skin. Other symptoms can include pain when peeing, a thick discharge that comes from under your foreskin, bleeding around your foreskin, an unpleasant smell, difficulty pulling back your foreskin, though in young children it's normal to have a tight foreskin. How's it treated? The treatment for balanitis depends on what's causing the condition. Treatments can include antifungal creams. Creams, such as clotrimazole 1% and miconazole 2%, might be prescribed if the inflammation is caused by a yeast infection. They typically applied twice daily for 1 to 2 weeks or until symptoms resolve. Anti-itch creams, over-the-counter and prescription anti-itch creams, can help with itching and redness. Steroid creams, creams containing corticosteroids, can help relieve inflammation and itching. Antibiotics. If a sexually transmitted infection is the cause of your symptoms, your provider will treat the infection with antibiotics. Dicloxacillin 500 mg or cefalexin kid, times 7 days, and mupirocin topical cream, applied TID for 7 to 14 days is appropriate if there is a concern for concomitant cellulitis or a secondary infection. Thoroughly cleaning your penis more often. Don't scrub or excessively wash your penis with harsh soaps. Warm water is often enough. Diabetes management. If you have diabetes, your provider will show you how to manage the condition. Circumcision. If you have recurring symptoms of balanitis, your provider may recommend circumcision. Circumcision is a surgical procedure in which a surgeon removes the foreskin covering your penis. Surgeons recommend this treatment most often for people who have an especially tight foreskin. If you don't want a full circumcision, your surgeon may recommend a dorsal slit. A dorsal slit won't remove your foreskin, but it will open the tight ring up so you can see the head of your penis. Other treatments include aspiration and sclerotherapy, though these are rarely used. During aspiration, a special needle is inserted into the spermatocyst, and fluid is removed, aspirated.